this is a kind of a presentation in a way, but an explanation of what we're trying to achieve, or hope we are trying to achieve. And clearly I've been a dentist for over, 40 years, I suppose. And this is sort of about how we can engage the public. So this I remember from, I was in Parma and I just got an iPad, and that's a bit of a giveaway. And I only found that yesterday, that picture, but I knew obviously that I'd done it. I was trying to think of a logo, because everyone has a logo. And again, I've been playing around with my iPad, and this I definitely did in Parma, because I remember doing it. And I don't know how long Van Gogh took to do his flowers, but it didn't take me long. And I have to say, I think mine are a lot better. So basically, I just pinch people's ideas. Yeah, it was on the iPad. But it can be useful. And then you just kind of progress. And I think this is what this is about. I'm no Einstein. I know a few who are, but it's known a little bit of everything. So there we are, there's my logo. Got tidied up by someone who knew what they were doing. And I'd say just pause if you want to know what I've been looking at. But basically everything you look at, it's the bottom right one to look there, are things that they're nothing to do with, they are to do with dentistry, but none of them, they're all non-dental. So there's a variety of books, not big on books. I think these books clearly are on my iPad. So you get nudges in there a lot, I hope. And and I listen to a lot of podcasts. There's some great podcasts about them. That's the one on marketing, which you will have heard me go on about. But this is the one that is really what the NHS are after. They're after innovation. Except, as he says in one of his many lectures, there's no point looking for data if you're trying to innovate and do something new, because the data's not there. And therein lies the problem. If they want to wait till I've got data, then we're going to be waiting a long time. Anyway, so this is kind of one of his slides. And so basically what we're talking about is that he was saying that the nearer you get to the middle, and more people are going to the middle, and dentistry is definitely like this now. No one's allowed to do a root filling on the periphery. You have to go to a specialist, which the cost is a lot more. Anyway, we're not going to talk about that. So anyway, when it comes to having the equipment, shall we say, it's quite cheap at home. You've got a toothbrush. Say we go into the hygienist surgery, well, it hasn't got the turbine, I suppose, and may not have the X-ray unit in, who knows. But then they get into the surgery, and hopefully we've got a few more tools and a bit more equipment. It's more expensive. Then you've got some guy that's probably doing a lot of endo, and he has microscopes and everything. But ultimately, we end up in the hospital, and that's where you go if you've got cancer, oral cancer, or it's thought you have oral cancer, and that's where you'll get treated, and that's a lot more money. So this really is about oral cancer, but it's also about prevention. So again, on the outside for prevention, you've got the family, you've got the parents telling the children to brush their teeth twice a day, hopefully. And then we sort of progress into maybe oral health educator, or them getting some, it will be an oral health educator, because now we've just jumped into the magic ring, which is the NHS, and maybe we're not in the magic ring now. And then then you go up to the hygienist, say, and that's it costs a bit more, and then you get to see the dentist, and that's a bit more again, and the specialist is even more. But as we're talking about oral cancer, all these, it's the referral system to here that's expensive, and it's more expensive the staging, and less likely it is to work. The figures are awful. So what can we do with the public who are just on the fringe of the NHS there, and the oral surgery right in the middle, which is reasonably expensive, shall we say? So we all are within the system, one place or another, and at the moment we can refer. Doctors are also in there as well if we're talking about oral cancer. So we're talking about how we can use the phone, which I said is on the outside. So we'll come to that in a moment. But basically, that's the referral pathway. And the quicker you get in and have probably your biopsy, the better. But there are places that we may be able to refer to from our phone, and they already exist. And And actually, to be honest, they're probably a little bit more expensive than, it's not that huge a saving when it's privately run, but they certainly exist. And what we're trying to do is to go the other way down. So when you're looking at treatment, you want to keep treatment to a minimum, really, and the cost at the minimum. And maybe we should use e-health more if we believe in it. So these are a couple of the snapshots from videos within my app. The top left one, it goes on to show a reverse of the picture, but it's basically just from playing around with your iPad. So have a look at them. And a few years ago, I asked patients what they prefer, and they prefer animations to looking in people's mouths. So that while they're homemade, these animations, I think they're definitely what the patients prefer. Yeah, and the one on the bottom left, which is the other ones are still, that's quite relevant for what you'll see next, because this is what I think we should be doing. My idea was to have a standardised toothpaste lid that would have a set colour and a set size. I'm sure people will think of something better. Oh yeah, and these are snapshots from 2018, just when I started to do my app. So you can see it's got a little orange tinge there, Teeth for Life. But if you have a look at them, yeah, these are most of them are kind of still there. Prior to this, I had about 3 or 4 different ones for skin cancer, but then, they just got they were deleted because they just weren't followed up. But there was the skin cancer one. I looked at it earlier today, and that's still around, but it's in the States, or not so much in the States. You have to pay for it, so I didn't get very far. Yeah, and you've got these Bluetooth with electric power brushes. I think power brushes, you get better results. Never quite sure if it's got the 2-minute timer or the head. And there are lots of things we can talk about, but we're talking about cancer. This food scanner I really like. Oh, and there's So the way that the difference with what we're talking about here, about using patients getting to use their phone, is it actually sits outside that ring that you saw for what was, in that case, the health service. And so it's definitely not a diagnostic tool, but it's probably a diagnostic aid. And this is where I really struggle, because as you can tell, my English isn't great, and it's my first language. But that's what you find, is that we play around with words quite a lot. But what we're talking about here is using the patient's phone, or not even the patient, the user's phone, to enable them to look after their health a bit more before they jump onto what is the more normal kind of pathway. Or maybe this pathway we can change. And yeah, there are people who are doing it. So you have a quick listen to this. But if this is feel that you're interested in, then the YouTube video is within their website, which is where I got this from.
The joy of working with Skin Analytics is you've been very reactive with suggestions that we've made.
Integral to introducing AI diagnostics were the clinical photographers who helped shape the design of the smartphone app and took their skills out to patients at community hubs.
Well, these aren't the community hubs, but this is InHealth, and clearly these people are out there already. And what we're talking about is, if we can get people to use their phones and then communicate with these companies, then soon we can have a different pathway. So I know that company haven't developed something for in the mouth, or they may well have done without me knowing, but I won't be developing it. But it is interesting how good these phones are. Well, actually, the phones aren't that great, but their cameras, now they're getting really special. And you could see that the people just added an attachment to the phone. So it might well be we just need one of those attachments within a 20-mile radius of everywhere. And that would be a relatively cheap way of just keeping an eye on people. So with this app, the way that it'll work is we just need to tell people about it and actually showing them how to use it, although it should be self-explanatory. And it was always like a reveal to if they were in the green for losing their teeth from gum disease and tooth decay. But the reveal was the oral cancer risk. And then the idea was that there's a video, and it's not one of mine. This is the one video that isn't mine, and yeah, I did one for myself, but it didn't. Yeah, should have had a shave, and it still wouldn't have looked good. So this one's far better, but it has that magic word routine, and to help with the routine, you want to advise people to set reminders, and you know, if you are asking people, do they want to check themselves? Clearly, nobody wants oral cancer. Clearly, nobody wants cancer. But if you did have it, you'd rather want to know early rather than late. And yeah, so I could probably play around with the reminders for different things. But yeah, so that's what's meant to happen. And when you're reminding people and they look in the mouth, well, you know, in that video, it actually says, well, check everything else at the same time. It'd take you like a minute. And yeah, use your camera, you know, or get someone else use the camera. And it has a little bit more detail. And so while, you know, oral cancer is the 6th most common cancer, there are others that are far more prevalent. Some of them can still be spotted, and it's the same nudge, isn't it? That's all you're doing. You're just trying to get people to keep an eye on themselves and get themselves in early, if appropriate. And this is about how you do the routine. So the routine itself was actually, it was actually done by a guy called Claude Hopkins, or that's somewhere else. And yeah, I don't know, that sort of, yeah, there's a little video there that clearly didn't work. But it's all about having a habit loop. And the cue is, you know, for dentists, oh, there we go. The cue is for the patient is having the toothbrush visible in the bathroom and doing it twice a day, the reminders for your interdental brushes and that kind of thing. And you get this loop, and that's the idea. I'm not explaining it very well. I was a bit thrown. But there it is, it explains a bit more there. And yeah, and the part of it is that you get a reward. So I've done one of these for children as well, and the same applies to adults. It's the same thing. We just got to get some kind of reward loop, and it has to be really simple, really basic. But in this instance, what we're saying is, well, in that loop, once a month, a little signal comes out saying every Thursday night, check yourself for cancer. Yeah, and so look elsewhere, but that's about a reward. I'm just trying to be clever. So what we are doing is we are in the business of promoting health. Unfortunately, the National Health Service, when it regards to dentistry, is more like the National Dental Treatment Service, because we only get paid for when things go wrong, and it's rubbish. So what we want to be doing is explaining how the BPE is related to general health, and yeah, so that when you physically hand over a card to a patient, then which got their details on one side and your details on the other, then that's kind of a win-win. And they trust you. So that's the difference. Is if they're given something like this, which is to promote health and to get them for early diagnosis, then they're more likely to use it, rather than if they just see the QR code in the chemist. And there's some fantastic videos in there, if I say so myself. I think this is one of the first ones, and it's difficult to make light of. Actually, no, this is a different thing. But anyway, I was trying to be funny. The video's still in the app, and I think the joke at the end is still relevant. And certainly, this is sort of a promo trying to get us involved with the health service in promoting or not promoting screening for oral cancer. And actually, this is talking about screening for oral health in general, in that it was the actual, this is a 27-year study, it's a big study, there are the details if you want to go and look at it, it's very recent. But what they found out that people who had less teeth, which we should associate with poor oral hygiene, were more likely to have heart disease and die early. And surprisingly, it also says fewer teeth were related to higher cancer mortality. Well, you know, if they got less teeth, they probably, drink too much, smoke too much, or stress too much. But having a healthy mouth helps a lot more cancers, rather than just oral cancer. Oh yeah, and so this is just to say what we should be doing is we are a very trustworthy resource. If you are happy with the app and the content and you hand it out to the patients, they're more likely to use it. It's not something that people want to know about oral cancer, but they do want to have a nice smile, and the app helps guarantee that. And yeah, and there you go, that's you handing out your card. And so the thing that we're asking for, and the reason that I'm applying for screening, for funding for the screening, is that clearly the app's not, it's what I've made. It's nearly everything in it is my idea. I don't think many of that original, but I need it in. I know from conversations with different AHSNs and spoken to a lot of people, they want it to. The health service would want it in multiple languages. Well, for that to happen, I have to totally rebuild it, and that's going to be more money than I have. More money than I have to spend on an app that's not too many people are using. So what we want is also teledentistry. Well, it's gone quiet after COVID, but actually this is done a lot in the States now. There's big companies, and which I've spoken to, of course, and the way that they operate is great, but they're very expensive. This is meant to be a free service because it's to support the NHS. Anyway, so what we want to set up is using the camera on the phone for early diagnosis, for early referral for those who haven't got access to a dentist or a doctor. And so if you have that service, then also you use the same service for just basic oral hygiene instruction. There are an awful lot of people that we don't see, but for a variety of reasons. And as you know, it was in that podcast, the first part of this, about how we ought to be educating our patients. And the last thing you should pick up is your ultrasonic when it comes to oral hygiene. They can do the disclosing themselves at home and save messing up your surgery. And it's very green because the hygienist or the therapist can work from home. The patient's probably happier to be at home, and also it probably more money for the hygienist because they can be paid directly. Less money for the user, the patient, or they might have it done under a plan. There are a lot of ways that this could work. Yeah, because if your surgery is free as a dentist, then you're able to do treatment when everything else has failed. And the app at the moment really doesn't keep the history for the BPE, and that would be a useful thing for the user to engage with. And a couple of the things, general health. So notifications, to be GDPR compliant, then the notifications only go to everybody, so they'd just be general notes. However, if you had your own app, so you use what I have as a template, then it could be a lot more customizable. So you can just see here the other things I've added is a different way of, you put the top 2 videos of what the patient needs from your point of view, and the bottom 2 might be what the patient wants, and so those videos sit at the front. And after you've seen your patient, you should have it synced with whatever practice software you have. You send out a link a fortnight later saying, did you want to have that did you want to have that implant? Did you want to have that Botox? Did you want to have that adult orthodontics? All these things I actually didn't do, but you can. And so when we're looking about money and the cost for this, is a funny way of funding, but why waste the computer power that people carry around with them? So these are just a couple, obviously there's lots of screenshots here just to remind me of something to say, but in general, everyone has a smartphone, and people prefer viewing stuff on videos. It's just the way that it is. So on there, that's what he's saying. There are over 50 million users, and this is how much you pay a month. And do the maths. It's a lot. this slide should have had little bouncy bits. To be honest, it's probably better as it is, but it says how much would clients or patients pay monthly to look after their teeth. Then this is, you know, they're more interested in their smile, so most people are just interested in their front teeth. But maybe we should be saying, well, how, you know, instead of saying your teeth, we should be saying about your health. And poor teeth are a byproduct of poor health. So, by the same token, how much would you pay for delegating the service? You know, giving oral hygiene advice, if you're fortunate enough to have a hygienist, then you probably pass a lot of this off to them. It's very unlikely you'll have a hygienist if you're seen on the health service, as we know. So it's more cost effective for you and the patient if they see someone else. It's even more cost effective especially if you don't have a hygienist, you can delegate that via a phone. And as you can see, this isn't really it's definitely not to replace anyone, it's just to support them. As you know, most people don't really listen to what we say when they're in our surgery environment, but everybody looks at their phone. So, yeah, so hopefully you've downloaded the app, because that may help show that people are engaged with it as far as the NHS are concerned. And that way we may get funding for making these amendments. But, you know, to be frank, it's very unlikely that they're going to give one individual who hasn't got a business currently sitting around him the funding. But I'm not asking for a lot of funding. It's probably, if I need about 50,000 to rebuild it. I've had about 4 quotes, but it won't work, whatever I get done, unless this was the other page to the course I did on e-health. I'm pretty sure it's up together as regards to expertise, in that it follows the guidelines of that updated the Better Oral Health Care Toolkit. It follows all that. It's got a few other bits thrown in that may not be quite so popular with regard to how many children have GA extractions. But if you don't like what's in the app, then send me. We'll know. What we need is a consensus. What I need is a group of people who agree, or I can modify the videos for. You can see I can do it very quickly, and sadly, it just needs the same voice, the same sort of the same kind of animations to be consistent. To change them all, so I can do better videos, but to change them all, it's going to take a while, a lot longer than it does to do this video. And the other part that's missing, so both these parts are missing, I think everything else is there, is a big part, third-party endorsement. So in this case, and this is why I'm chasing NHS, is that, if we can get the funding for oral cancer, then we actually, by default, get the funding for prevention with regard to oral health. So that's what I'm trying to piggyback on. So let's hope that we get it. But the other part is that, why don't we do it ourselves? I mean, crimes we can... It's not a huge amount of money that we need in order to provide not an alternate health service, but we can sit outside the health service, but promote health. And I've put that video in. There's a few people already doing this. And we should be promoting them. So we could have this whereby I do get funding from the NHS, and they say, right, well, we want to brand it. I'm living the dream. But my app has always said save a life, share teeth for life, because it was about oral cancer, and it's very unlikely that we'll get it. But, I've seen about 4 cases, one of which was a friend. However, that's what I'd say is, so the person who actually has done more for health when used correctly advertised his iPod, was it, as 10,000 songs in your pocket. So why not your dentist in your pocket? As you know, he wouldn't let his children use a phone or IT because it's created so many mental health problems. But at least we can use it for screening for oral cancer. And yeah, if there's someone out there who wants to engage, it'd be far better, and far better for the profession, when we're always getting these political kickbacks saying that we're not looking after people. I think even the general public are well aware of this now. And we should try and think slightly outside the box. And how can we help the public? Well, and, get the balance right. There are far too many people having difficulty getting access. This is a different show, and that's the following week. So I might go to that, but it's interesting because they're on, I think it's on the Wednesday, early diagnosis of cancer. So that might be worth going to. Obviously, I'm retired, so I could probably nip along and see what they've got. But also the thing about diabetes. So there's funding for diabetes as well. If you read the green paper that was on prevention is better than cure from Martin Hancock, as you know, it only covered the under fives, and I hope this thing for fluoride goes through, but will it? And so I've done my survey, so please do the survey. As you can see, not many people have done it, but then I haven't really banded it out. But the public, quite a few, more of the public have than anyone. And but the interesting there is, if you could read it, it says that most people pay monthly for their phone. No one pays monthly for their teeth, so we've only had a few people respond, but that'll be interesting. But they would also, they're far more happy to pay for health and treatment, which is a little bit of a surprise. But my gut feeling is that, well, maybe they know they need treatment, so they're trying to get in on, as we all would. And so these surveys are sort of quite useful, but it's how you interpret them. So in the cancer screening, it said, would you prefer to see your dentist once a year to check yourself for screening, and or check yourself monthly? Well, once a year is not enough. You need to be checked every month for, squamous cell carcinoma. It's once a year. That's no good. But so we need to educate the public along those lines. Anyway, I think that's the last slide. So I hope you found it reasonably useful. And if you're from the NHS, trying to remember the name of the funding organisation now, please give me some money.